to offer you public health topics that are relevant and also will help you, in your daily work. Thank you for attending. I hope you find today's presentations informative and interesting. Have a good time today and enjoy. Thank you, Chris.
You're welcome. Barbie, did you want to say a few words?
Real quick. Thank you everyone for joining. I'm sure you are aware of all the major changes we had to staffing during this pandemic. I am pleased to now be the Director of Patient Services here in the nursing division. It's been quite a ride, and I want to say thank you first to all of you, our partners, and for all of your hard work that you did. And we are aware of it, believe me. And it was appreciated. I think collaboration was the key throughout this pandemic, and motivation and not giving up. And I just want to say thank you. Plus, I want to say a quick thanks to everyone here in the health department. We all work together, not just in the nursing division, but upstairs in environmental health and codes enforcement, early intervention, the lead program. Everyone participated with helping during this pandemic, but especially I do have to say the nurses here really stepped up and working 7 days a week, many times, and it's appreciated. And we did it, and we will see what happens. We're just not going to give up. I want to assure you, and thank you for everything. Heather, I want to say quick thanks to Heather too. She's now our supervising community health nurse, and she did a lot of the contact tracing work, and it was amazing. Ellen Cohen, she collaborated with me on vaccine all of our pods, and we could not have done this, I will say, without Ellen's efforts in our vaccine pods. So thank you, absolutely everyone. Answering the phones, our clerical staff, they never stopped ringing, never, for a long time. And to put up with all of those calls was just amazing. So we are now smiling for now, and we will see what happens. And thank you, everyone. Dr. Cohen.
Thank you, Barb. And to reiterate what Barb and Marcus and Isaiah would have said if he was on, we do appreciate everyone, especially in healthcare. But honestly, if you look at what it took to get us through this pandemic, it was everyone, all frontline workers, whether it was, in healthcare or, keeping the groceries open, or even environmental health. Isaiah, thank you. As Barb said, they really augmented our services that we just could not have done without it. So that said, I'm actually going to talk today about COVID, but not, I think, in any way that you all have heard about. I think you all saw the teaser there, past, present, and future COVID-19. And I really want to tie this back to, what are pandemics, zoonoses, things like that, but give kind of a historical context, both for the past and probably for the future. We're in a huge lull now. We were up over 100,000 cases a day in the state. We're now down, last I looked several days ago, 7-day average was right around 1,500, if I recall. It's probably even lower. Could we go back up again? Sure. We don't know. We're hoping not, but it is a good possibility based on what we've seen in Europe, Asia, and elsewhere. But that's not really what I'm focusing on today. I'm focusing on, where we are, where we were, and where we could be. So with that, we'll go ahead and get started here. Those of you, which is probably most of you who have seen me speak, I do prefer to, excuse me one second here as I get out of here. For some reason, my screen occasionally won't share if I already start the presentation, so I have to go back. I prefer to have questions asked, you can raise your hand, you can speak out. It's not going to interrupt me too much. Don't worry too much about it. I did put in some placeholders for questions during the presentation as well, so we can use those. But I prefer this to be kind of more back and forth rather than me just spouting for however many minutes and then having questions afterwards. So please feel free, whether that's our public health staff or any of our guests on the lectures, please feel free. So we'll go ahead and get started here. So I'm Scott Cohen, I'm the medical director for the health department. Looking back, I think it's been about 16 years. We've had some little outbreaks in the past of meningococcal disease, meningitis. We've had, pertussis and some other things, but we've never had anything like this. And I'm hoping in my lifetime, this is the last mega pandemic we've had. So just first, before we get started, many of us have roots in Eastern Europe in our genes. So just please, think about our friends in Ukraine. Healthcare workers are not immune to this. Unfortunately, there have been a number of deaths of healthcare workers, reporters, and others. And Doctors Without Borders and other non-governmental agencies are really struggling to try to help the population there, of which several million have already fled Ukraine. So just something to keep in your minds, hearts, and donate where you can. My charity of choice there is Doctors Without Borders. And Jimi Hendrix, I think, said it best. This is one of my colleagues at Bassett used this quote the other day, so I am kind of stealing it. But when the power of love overcomes the love of power, the world will finally know peace. And this was not, someone who was ethereal. It was Jimi Hendrix. So pretty cool that was actually out there. So today, I'd really like to discuss the origins of pandemics. And Susan will talk about, somewhat of the definitions, what those are, but I don't want to get into too much the technical details of this. I'd like to discuss some other pandemics, not just SARS-CoV-2, which is the virus that causes COVID-19, but Ebola. Many people think HIV is a pandemic, or at least was. Now it's under, much better control, but not perfect. And influenza becomes pandemic many times as well. We're going to talk about, this is not new. I mean, pandemics have caused a huge amount of havoc in the past, from influenzas to the Black Death, there's been a lot of them. So we don't want to think this is new, but I will say that the prolonged nature of this pandemic has been really awful, to say the least. We're going to learn not only how the havoc was caused in the past with some of these things, but what we can do to impact the future pandemics that we're going to have. This is going to have. Maybe they're not as severe as COVID-19, but we will. Again, please, ask questions, bring up discussion points. Please go ahead and do that. There are spaces for that, but feel free to, either raise your hand. I'll have Chrissy, if you don't mind, if you could monitor that. I cannot see the chat or anything in here while I'm in production mode on the Zoom screen. Or you can put the screen in the chat box and Chrissy can kind of bring that up as well. Questions before we get started? Okay, getting started here then. So I'm hoping you all can see my screen. Barb, you're at the top of my screen. Can you see the COVID-19, the beginning slide?
Yes.
Okay,
that's great.
All right. So in the beginning, I'm thinking back now over 2 years. So January and February, early 2020, I was down at a function. I fly for the Civil Air Patrol, which is the Air Force Auxiliary. We were down at Binghamton doing something on the field. I think it was a Saturday in early March of 2020. And we were all called in for emergency planning related to this as the stuff really hit the fan in March. And I'm remembering just 2 years ago already, more than 2 years, that we've been going through this as a healthcare industry, as society, and individuals really struggling with it. At that point in February and January, even maybe December, depending on what you believe, there were a lot of communications back and forth between the U.S. and Chinese government. Many people back then, including some of us in healthcare, believed it was airborne, but no one was admitting to that at that point. That came, several months later. But at that point, even though, we did a whole bunch of things with containment and whatnot, it was way too late. And with the globalization of travel and commerce, there's just so much you can do after the cat's out of the bag. And we realized that a little bit later. But for 2 years, as it says on there, we've just been consumed by wave after wave. We're now in a really good place, but we never know what's going to happen in the next few months, especially as some of these newer subvariants of Omicron have come out and are now plaguing Europe. I think the one that's out there now is BA-.2. So just, be aware of that as we move forward. And some of the variants have been more dangerous. I call that Delta. Some of them have been most of them have been more transmissible. That's why they get selected out by natural selection, is because they wind up, being more transmissible to more hosts than their progenitors. So, getting back to that, there were multiple variants early on that we never really talked about. Alpha, beta, gamma was in Brazil, lambda was in Peru, mu was in Colombia. There were many others, but they just kind of petered out. They weren't dominant strains. They weren't quite as strong in terms of transmission, as others. So, alpha really was more predominant than anything. And one of the things we realized is that some of these strains were able to evade the immune system. Like, if a person was infected with one strain, they could potentially get another within a month or two. Some of them were more transmissible. Some of them, even now with vaccines, are not quite as responsive to the vaccine, if you want to use that terminology. But despite that, the vaccines are all still very effective at preventing death. And you'll hear me say this in the future, and I hope Barb and others will as well. All of the vaccines are still good. All the ones licensed in the US anyway are really good at preventing or at least reducing the risk dramatically of death from coronavirus and hospitalization. And those of you who do hospital medicine like me will know that most of the people we have met over the past few months have been those people who are not vaccinated, and deaths likewise. So, right now we're more focused on Omicron. Delta is still probably a little bit out there, but not quite as much. Thankfully, Delta was probably more virulent than some of the others. We saw a lot of death and destruction with Delta, less so with Omicron, but we're not sure whether that's related to the fact that, Delta had less, we had less vaccination during the time of Delta than we do with Omicron. So we're not 100% sure. So again, we care about these variants because, they're contagious in different ways in terms of how contagious they are, their virulence, meaning how potent they are at causing death and destruction, as well as their responsiveness to drugs. The new drugs that we have are really good, not 100% effective, but good. And antibody infusions are the older antibody infusions are not as good for Omicron as others. And we realize that some of these variants, as you've heard, have really overwhelmed the healthcare system in certain areas at certain times, causing just major issues both with healthcare workers as well as rationing of care. And you've all heard this on the news that California got overwhelmed, New York City got overwhelmed, Indian Nation hospitals were getting overwhelmed. It was really in this kind of peak and wave fashion, just kind of crazy. I will say that there are certain things that that may or may not be under our control that I'd like to address that could help us in the future with pandemics. And we're not going to go into this, in great detail, but I will say, if you look at some of the numbers, they were a little disturbing. Black and Latino New Yorkers, if you look at that, much higher rates of hospitalization in New York City specifically when they looked at these rates than white or Asian New Yorkers. And we know that if you look at populations, there are certainly higher rates of underlying health conditions, whether it's diabetes, heart disease, hypertension, you name it. There are more population constraints, meaning people living in more congested areas, whether it's public housing or others, in some populations versus others. Really just read poverty in this, okay? And also decreased access to some of the top tier hospitals that had some of the experimental drugs, whether it was some of the drugs that we use still inpatient right now, or even just something as simple as steroids that we were, experimenting with and seemed to do well. But 2 times the hospitalization rate for Black New Yorkers in New York during the surges. That's really appalling if you think about it. And then if you look at it, New York City life expectancy all told, 2019 was 81.3. Non-Hispanic Black New Yorkers, 77.1, and Hispanic, I'm not sure exactly why, but was higher at 82.3. We don't know if this is genetics, environment versus, the genetics. We really don't know. And same thing for infant mortality. It's kind of appalling. 4.2 for 10,000 live births versus non-Hispanic Black New Yorkers, 3 times higher. It's crazy. And then premature death rate due to heart disease, almost 2 times. Heart disease itself, in terms of deaths, is 2 times higher just in high poverty neighborhoods. So these are the things we have to think about when we're talking about, our response to pandemics. Where do we respond first? How do we concentrate our efforts? How do we concentrate some of our educational efforts where we know there's somewhat hesitance to immunizations, hesitance to, trust healthcare, trust, authority, health departments, police, you name it. I will say there is a bit more vaccine hesitancy in some populations. There are some struggle or some worries that are just simply not true. Those of you who have heard me speak about vaccines in the past have probably heard me say that, a lot of people worry, was this a rushed process, to get these vaccines approved? It was not. That is absolutely unfounded. They worry, was it political? Well, okay. Donald Trump's administration pushed this through as Operation Warp Speed, one of the best things he did during his administration, and now Biden's administration is continuing this. So both sides of the political spectrum have been involved with this. So you can't use politics in that. I mean, that doesn't make any sense. When the vaccines were going through their approval process, the reason it got through much quicker than we would expect is a couple things. One is that the mRNA process had been out for about 10 years. It was never commercialized or used, but it had been out for a long time. The other is that if you look at the way we enrolled patients in studies, and we do enroll patients in studies, whether it's drugs, vaccines, or others, typically it takes us years to enroll a full panel of patients. And what we heard during the enrollment of each of these 44,000 patient panels was that they were overwhelmed with volunteers, some because people just wanted the vaccine, they were scared, they wanted a chance to get the vaccine, but most were really just people saying, I'm stuck at home, I want to help in this. Healthcare workers, everybody else on the front line, are struggling, we want to do something to help this. The CDC, the FDA, and others were also told, I know you normally meet quarterly, but if there's data that comes out that needs to be reviewed, you will be meeting within a week, period, done. No waiting, none of the typical red tape that was, typical for approval processes. And last but not least, and definitely can't discount this, is money was thrown at these with abandon. Where else have we said, you know what, we know your drug is not approved, go ahead and make 1 billion doses of it. And if you have to throw them away, that's fine, we'll pay you for them anyway. Never have we done that before. So research and production were in tandem instead of in sequence. So this is why it got out quickly, okay? There are some other fears too that are really, more conspiracy theories like chipping, if you get a shot, the government will be able to track you. Well, I will tell you right now, that's not true, but guess where you can be tracked is your cell phone, okay? And everybody uses those without issues. The fears about fertility, I kept hearing during this, I don't want to get the shot because my granddaughter could become infertile. Okay. Or my coworkers, I work in a, cubicle farm, and, if I get the shot, my coworkers could become infertile. That, that's more a conspiracy theory than anything. And it turned out that fertility scare was from a Pfizer scientist who was fired for cause. And he was looking for reasons to, get Pfizer in trouble. And he kind of promulgated these things about placental antigens and whatnot. It was not real. But unfortunately, like many things, like the MMR vaccine and autism, it got legs by, just getting out in the anti-vaccine movement.
We heard that a lot, Scott. We heard a lot of moms, like pregnant moms, saying that. They were like, my doctor told me I should probably wait.
Yeah.
That was scary that some medical providers were buying into that.
it's really scary that some medical practitioners, even there was a story, and I haven't primarily researched it, but there was a physician in Texas who testified before the Texas House of Representatives that she strongly recommended against getting the vaccines, because if you do, you wind up getting, your body will be magnetized and you can stick your car keys to your forehead. And there are these things out there, even with medical professionals, that just don't make a lot of sense. Likewise, monoclonal antibodies, the drugs that we give IV after someone is known to be positive, in some cases anyway, once those came out, people were like, well, I'll just get those, I'm not going to get the vaccine. Monoclonal antibodies are a blood derived product. They are not safe compared to, a vaccine. They're still safe, but comparatively speaking, they are not. Much higher rates of anaphylaxis and things like that. Same thing for the anti-coronavirus medications. There's several out there now. And I do tell people, get tested and then we can treat with these medications now. They seem to be in more available now than they were before. And of course, as we talked about, the variants as well. So I'm going to stop here for questions, comments from anyone.
Scott, we just had a question in the chat box. What would you say to pregnant moms who are considering getting pregnant?
So moms of childbearing age who are considering getting pregnant, they're not pregnant now, is that what you're saying?
Considering getting vaccinated.
Oh, considering getting vaccinated. Oh, gotcha. I do tell people we strongly recommend getting vaccinated, including during pregnancy. And I know there are some OBs who don't recommend that, but that is not because of science. I'm not sure where they're coming from with this. I will tell you, from having admitted many people who were pregnant with COVID and then delivered even while they were sick with blood clots and all the other stuff, COVID in pregnancy, especially late pregnancy, is extremely dangerous. The morbidity rates and mortality rates are much higher. I strongly recommend getting the vaccine, including early in pregnancy. Thanks, Isaiah. Other questions? And again, I can't see the chat, so.
Well, I think that's all of them for now.
Okay. All right, so moving on. Some of the theories behind COVID-19, the SARS-CoV-2, are that, it came from a lab in Wuhan, China. It's probably not. It came from, animals as zoonoses. But as you can see on here, there have been many infections, including tuberculosis, which has been in Asia and Europe for many, many centuries, more than here, although it's here as well. Are starting to make comebacks in many forms because of travel, over antibiotic use, things like that. And then these new infections, which are zoonoses, meaning they're transmitted from animals, like Ebola, definitely came from animals. Zika, same thing. Swine flu, even HIV looks like it came from this simian, monkey virus that was transmitted to humans because of close contact and eating bushmeat, as they call it, wild animals, things like that. So, SARS-CoV-2 came from a zoo. No, it's, a zoonosis means that, animals had a virus. That virus was definitely infectious to humans, but because we don't have close contact with most animals that are in the wild carrying these things, that, they don't infect us until they do. And then once they infect us, if they are able to be transmitted from human to human, they now can become endemic or pandemic. And SARS-CoV-2 now is the one that everybody knows. It's a coronavirus, means that there's, these spikes on it that, crown them or coronate them. As you all know, it was first, reported in China. It's from the exact same family that killed just under 1,000 people with the 2003 SARS virus, and also that MERS virus that killed 700 people, or killed several hundred people in the Middle East. They have a lot more in common than we think. Most importantly is that they came from, non-human animals. And I found some pictures here just because I didn't really know what a pangolin was, and I suspect that most of you didn't as well. But like SARS-CoV-2, we think initially came from, pangolins, these scaled anteaters, ugly little critters on the left there. And we think that SARS came from civet cats in the middle, and MERS came from, dromedaries, which are, a type of camel. I mean, it makes sense from where these things were derived. And, there's obviously other intermediary animals. You hear, things about like bats and chimpanzees and others. Livestock species can cause things. I think about smallpox, tuberculosis, measles, things like that. But wild animals really are becoming more of a problem because some societies use them not only for meat, but also they're alive in close proximity to humans. And that's probably the whole bat thing from Wuhan. But like HIV, it came from chimpanzee virus, kind of a mutated chimpanzee virus, that came probably as early as the 1920s, but we think didn't become, human transmission until the 70s and 80s. Ebola is probably from bats, maybe other primates, we're not sure. SARS from bats and these palm civets, and then they have these kind of like indirect transmission, which is, kind of scary as well. Like a domesticated animal becomes an intermediary from one animal to another, which is kind of what we're thinking with SARS, is with some of the SARS viruses as well. Flu virus, people don't realize that flu kills, upwards of 300,000 people annually. It came to humans via poultry, and they got it. Poultry got it from wild birds, but they're kind of penned in, but other birds do mix in. So it's really, it's crazy. So I guess one of the questions that we ask is, well, how do we prevent zoonoses? Well, I mean, the most important thing is probably to figure out what caused them. And, we know that zoonoses are probably, if not caused, but, pushed along quite a bit by large populations, crowded living, and significant close proximity to those animals that are able to transmit. Most zoonoses, I would say, just become endemic, like tropical diseases. They come, they go, they live in certain areas where they thrive, but periodically they become pandemics, unfortunately. And I'm not 100% sure why, but it's in Europe and Asia where a lot of domesticated animals live. So these crowd diseases have typically developed, but unfortunately survivors become carriers of these diseases. And, as we altered the way people interact with other countries, and, it doesn't take weeks to get from Europe to the US now, it takes just hours. So these things transmit very quickly, and that's the globalization of travel now. But I think one of the things that we forget is a lot of these diseases really transform how people live, like malaria and sleeping sickness in Africa. It changes the way people live in Africa with sleeping nets and things like that. In Europe as well, plague, think about that, rats and hygiene, really changed us, way back when in the 1800s. And it really did increase, I think, some of the hygiene, the power of surviving workers, but also in some ways slowed urbanization over time. One of the things that I wasn't aware of until I did some research for this is that the threat of infection actually has changed the way we all interact with each other too. This kind of like this behavioral immune system. Someone's sick, you back away, especially now someone coughs and there's, and all these or something, and we're all like, okay, back up, that sort of thing. But unfortunately, it also motivates xenophobia, keep that group out of the United States because they're going to give it to us. It's already here, when we ban travel from China and things like that. It does, in some respects, though, enforce conformity to social norms. I've heard Chrissy and Barb, I think, say, sneeze into your elbow, sort of thing. Those are social norms. But there's some theories in social medicine that it even biases our preference to a partner, a life partner or spouse, because, it's about health and resistance to disease. So we're, kind of biased towards looking at a healthy partner rather than someone who's sickly, who could be, a victim of disease. So questions on that? I know there's a lot of social stuff that we don't normally talk about in healthcare.
Dr. Cohen,
Yes, ma'am.
I think something that I observed during this pandemic is more encouraging, more self independence. People became more self-reliant, I think, during this pandemic, and that's not all bad. I think that may have forever changed a lot of how we do things in the country. I think it may in the future be a mix of how it was before and where we will go. Just what I observed.
Yeah, less reliance on others, more self-reliance, more of that nuclear family versus, others. Absolutely. I've heard people say, yeah, my kids, we had one family we intermingled with for kids playing with each other, but everybody else we kind of stayed away from during the peak of of our surges. So yeah, absolutely. Other questions? Okay. So moving on, some of this we've already talked about, what drives zoonoses, sanitation, long range travel, contact with wildlife. But I think one of the things that we're working on right now in healthcare is, how do we reduce the pathogens that get re-empowered due to our activity, whether that's, hunting or giving antibiotics to livestock because low doses of antibiotics fatten them up quickly, but also promote resistance. How do we try to keep populations away from wild animals so that things don't jump from one species to the other? But antibiotics are at least one thing we know we can do. And we have, as a society in the US and Europe, really done a better job at trying to reduce overuse of antibiotics and creating these superbugs. But there are still, Mexico, if you look at it, antibiotics are over the counter. People buy it, use it, they don't need a prescription. So I think that is one way we can, look at this a little better. I think diseases have been contained in one way or the other. H1N1, remember that? Holy mackerel, that was crazy. But that was in large scale pig pens. And I think that originated in large scale pig pens. And I think what they're trying to do now is try to, realize that when we have these large scale animal factories, that they do have a cost, unfortunately. Exposure to chimpanzees, older diseases we talked about. And, just looking at the history, HIV is fascinating. I won't get into all the details. But in 1981 was when we started seeing just weird cancerous lesions and pneumonia in gay men in California and New York. Didn't know what they were. They finally called it, AIDS. And then eventually, several years later, I think it was, they realized HIV was the cause of it, this virus. And I remember in med school, up on C4 at Albany Medical Center, taking care of many people with pneumocystis carinii pneumonia and all sorts of other, invasive fungal infections like cryptococcus, meningitis. And then just 2 years later, when the drugs came out to treat it, all those wards were empty. And it really can be pretty amazing. Treatment, prevention, pretty neat to say the least. And, so that's one example of how a pandemic ends. But, there was interesting, this one person said how a pandemic ends is generally by becoming multiple regional epidemics or becoming endemic, I guess is better. It was just an interesting way of looking at it. Zika, same thing. Zika virus, 2015. It just caused mild illness in adults and children. But for pregnant women, oh my goodness, you had this epidemic of microcephalic babies who tended to have growth and developmental issues. And these are lifelong issues. And I remember the huge fear. I used to get calls from pregnant women or women who were, thinking about becoming pregnant, really fearful of this. And rightfully so. There were some transmissions down in Florida and other areas, but most of them were, gotten from either South America or even Puerto Rico. Really had a bunch of them as well because of its proximity to the Caribbean. And then for some reason in 2017, it just kind of disappeared. It burned out. I'm not sure exactly why. Probably because it wasn't easily transmissible. We know that it was transmissible in close physical contact, but that's really probably about it. So it kind of just, petered out. But unfortunately, when these things peter out, then the drive to develop effective treatments and vaccines and prevention programs kind of goes away as well. So it could be Zika is probably still out there in a smaller volume, but what happens when we get a wave and we didn't really invest anything in its treatment and prevention? Similarly, influenza for the longest time was the most deadly pandemic agent. And thinking back, and I was reading about this a little bit, the flu pandemic in 1819, I think it was Spanish flu, I don't remember, but it killed 50 million people around the world, including, almost 750,000 people in the US by estimates. Then another one killed about 115,000 and a further one, 100,000 more. We had I think it was H1N1 in 2009, but it really wasn't quite as deadly, thankfully, maybe because of medical care, maybe because of sanitation or the vaccines. I'm not 100% sure. But, in each case, the pandemics waned as the populations built up immunity. And then they became seasonal, our seasonal flu, where, we do have these endemics and occasionally we have short pandemics with influenza, but it becomes the normal. And I think, just to predict for the future, I think that's what's going to happen with with the SARS-CoV-2 virus or COVID-19, is it's just going to become endemic. We're going to have peaks and waves of it for years. We're going to get vaccines probably every year for those of us who believe in them. And that's what's going to happen. And then the death rates will be low, but they will still be there forever. And unfortunately, with COVID-19, in the healthcare industry, we just don't fully understand why do I see 32-year-old healthy marathon runners, dying from COVID, and a 90-year-old who got it, who, had a little cold sore symptoms, and that's about it. And then there's the mix in between. We do know it's higher risk of dying with things like obesity, hypertension, diabetes, cancer. We know that. But why do you have these weird outliers? We don't fully get it. It is kind of crazy. Questions?
Nope, I don't see any questions in the chat box.
Okay. So moving on. I'm not a history buff. It's not my specialty nor my passion, but I did a little research here because it was really interesting. So what does history tell us about pandemics? Well, one, they are certainly not new. So this was the Black Plague, Black Death. There are these ruins of a whole town in this English village of Warren Percy in northern England, completely depopulated and eventually just abandoned following, Black Death. And, I was trying to correlate that to our current pandemic. And, it's funny, as you start doing research on this, there were several people of, pretty significant stature who predicted this, not several, there were many. There was a gentleman named Ron Klain, who was a lawyer by training, but he was the White House Ebola response coordinator in 2014 and 15. And, in 2018, when they marked the 100th anniversary of that horrible pandemic of Spanish flu in 1918, where they noted, by the way, it killed more people, more Americans than World War I and II combined. They said, we really need to push more medical research. We have to, fund public health and, because there's going to be another devastating pandemic at some point. And that's because of global connectedness and global connectedness is like a double-edged sword in my mind, because, not only are you connected and you're going to transmit disease, but you have the ability of moving, people and technology to places that need it. And also the technology to communicate is so much better than it was even 10 or 15 years ago, because of global tech. But, he did point out too, that things that we talked about with China and others like xenophobia and isolationism, unfortunately can hamper a pandemic response in some cases, like Africa as well, where we should have been getting viruses and people, or not viruses, vaccines and people down there. And think about what he said. It was pretty prophetic, to say the least. and decreased funding for public health really hampered us with Zika and definitely COVID-19. I think back to when I first started working with the health department in 2004, I think it was. And you know, you look at our number of staff now, and there's only a few of us left who were there back then, but I would swear we had 30 some odd nurses back there. And granted, we had a home health agency back then, but in an emergency, we could pivot those nurses to emergency preparedness as well. We don't have any of that now. I would bet we have 8 or 9 nurses, right, Barb? It's not much.
Mary Ann probably remembers how many we had here, but you're right. It a lot more staff, and yeah, you work with less now, and this time we had to more efforts even, you know, so it was a struggle, but forming partnerships in the community helped.
Yeah, absolutely. And even Bill Gates, you know, back in 2015, they were talking about Ebola, and the Gates Foundation also does a lot for malaria prevention and treatment funding. And they were predicting, you know, a significant airborne contagion pandemic, which they felt at that time, that they, meaning the Gates Foundation, felt that we were woefully underprepared for. Again, prophetically, it was quite true. You know, as I said before, there are certain practices that really open us up to, you know, some of these things, like in China, unfortunately, the wildlife markets and things like this. Now, China does not allow the use of wild animals in these markets, but they also don't prosecute it. So it's kind of like they let it happen, but you're not supposed to, you know, you're not really supposed to do it. So it's really, you know, it's a struggle, not to mention that a lot of these animals that they're selling either parts of or the whole animal are endangered, but they really do increase our risk of zoonoses. And in China, I mean, it's a really massive injury. You know, a law that knocked all this out completely would probably drive it all underground and then couldn't be enforced. But I think the Chinese now are even, you know, pushing towards a permanent ban of wildlife trade just because of the impact of COVID-19. But this is just one branch of the public health need, honestly, and it's not just China that has wildlife trade, don't get me wrong, but it's one area where it's the biggest population in the world where we could have a significant effect. But, you know, there's other public health needs that we really have to push forward. You know, one is we have to increase cooperation during pandemics, and think about Africa and parts of Asia where 10, 12, 14% of people have gotten vaccinated. And, you know, we all say, wow, they have plenty of vaccine now. Sure, but they don't have the people, the vaccine, nor do they have transportation to get out to these hundreds of small villages where people live. So it's very difficult. You know, obviously we need to educate people about wildlife trade, and antibiotic resistance is a huge deal. You know, we talk about super bugs, and those are some of the things that we just have to make sure the population understands, so that they demand less of antibiotics and things like that, so that we as healthcare providers are empowered to, you know, do our jobs better. You know, COVID-19 being one of the worst ones, obviously, but we have to figure out how to contain it and prevent it. You know, you can't just prevent these things by killing animals that, you know, potentially have it, because it's already out by the time we know about it. You know, palm civets were decimated after the SARS outbreak, but it didn't really, you know, it didn't really control it. And honestly, the reason it got into our population was that they were being hunted by humans in the first place. So we just need to, you know, get rid of that practice. And Chinese traditional medicine does still encourage wild animal parts like rhino horn and things like that really don't have any benefit. And if we can, you know, try to get that practice removed, we'd probably be better. There is definitely evidence that Eastern medicine is helpful, but certain practices like, you know, some of these animal or wildlife animal parts are definitely not helpful. So, you know, moving on, we know that it was declared a pandemic, COVID was declared a pandemic in March of 2020, which was right around the time that, as I said, we were down in Binghamton and got called in for, you know, crisis management. You know, we really can't say that the pandemic is over. We know that. But it's really, we'll have to figure out when there's a sufficient decline in cases in as many countries as possible. So there's no target thresholds in terms of when we declare it's over. You know, we know that the cases are declining in the US and other places, but if you look at the UK, New Zealand, Hong Kong, other places, the numbers are rising pretty dramatically. And I suspect now with mask mandates removed that we're going to see another bump in cases here in the US as well. I talked about vaccines. You know, unfortunately, the WHO didn't do as great a job as they could have at pushing vaccines out quickly to those areas where, you know, we talk about all of these variants being developed. Well, they were developed in areas where there weren't enough vaccines. So we definitely need to do that. And Dr. Ciro Ugarte, who's, you know, the PHO's Director of Health Emergencies, we still need to approach this pandemic with a lot of caution. So that, you know, most out there in public health and the world stage are saying, you know, it's not there yet. So, and I'm trying to move on a little quickly here since we're getting close, but, you know, when will COVID end? We don't know, but we think past endemics provide some clues. There's a bunch of research on this. There's, you know, its end is a long drawn out process, as it says here, but there's a medical end, meaning like when the cases drop fairly dramatically towards, you know, whatever endemic phase are going to be. But then there's a political end, you know, when does the government end prevention measures and tracking, you know, like we've already ended tracking really in New York many months ago now. And then the social end, which we're probably getting towards that now, where people kind of just move on. And it becomes, yeah, it's like the flu, it happens every year, whatever. In the United States, you know, we do think the end is near, but we're not sure. But about 65 to 70% of Americans who are eligible are fully vaccinated. Most, or some at least, are vaccinated and boosted, and the cases are falling. So we'll see. That's all I can say is we're hopeful, but I wouldn't be surprised if we don't get another, you know, bump in cases at some point. You know, we've had almost 1 million deaths now. 1 million in the US, 6 million worldwide. You know, it really is kind of crazy. We were worried that this pandemic of flu, of H1N1, you know, in the late 2009-10 was going to be as bad. It turned out it wasn't, but we're not sure why. So again, we don't have a full understanding of pandemics. So there are some takeaways, but unfortunately, you can't just, I don't know, you can't just apply them all. But there are commonalities we talked about. There's this divide in socioeconomic classes, xenophobia, that fear of the invisible enemy, especially initially in pandemics. But I will say, you know, to wrap it up here, there were a lot of positive things, you know, and in my role in Bassett in virtual health, you know, we really have come to improve our ability to deliver care to patients where they are, you know, virtually in many cases. And when they come to us, you know, it is a safer experience. We don't have people sitting in waiting rooms for hours, things like that. We have noticed both in healthcare and other industries that there's a lot less need for bricks and mortar. A lot of people are working remote quite successfully. They are quite productive. And this actually provides new models for daycare, which was a huge shortage as well. You know, there was a really big surge in volunteerism during COVID-19 for, in a lot of areas. You know, it's funny, you know, if we look back to where were vaccines given in Shenango County, a lot of them were given at like private pharmacies, like Bartles was the, you know, bellwether for this. And there are some people on this call who were volunteering and may still be volunteering, giving tens of thousands, over 10,000 vaccines to our population as volunteers, some retired public health nurses. You know, EMRs have been able to help study interventions in real time, you know, electronic medical records. And technology has helped with people staying together, even if they're not really together, like Zoom and FaceTime and things like that. So we have to look and you know, take all these things in context and say, you know, what's the next pandemic to come down the pipe? What lessons have we learned? What things do we apply to make the next thing better? Is it a new virus that causes problems? Is it superbugs or these weird, disorders called, these weird virus-like particles called prions that cause things like Creutzfeldt-Jakob disease or mad cow or deer wasting disease, same sort of thing. And how do we prep? How do we push volunteerism so that, the next time this comes out, we have people who can vaccinate who are not nurses, doctors, NPs, PAs, and others. How do we continue to push remote work so that, we can push people out into the diaspora so that they're not infecting each other, and including remote healthcare. And then going forward, we learned a lot regarding rapid cycle evaluation of testing, different types of tests, vaccines, and also monoclonal antibodies and drugs to treat, these crazy viruses. Some of the things we still have to work on is, fact versus fiction. And I try to tell my patients that, just because you read it on Facebook, does not mean it's true. And, just because you have a belief doesn't mean it's a fact. Facts are facts, beliefs are beliefs, and we have to teach people, I think, to be critical and understand the difference. And a lot of people just don't. And I'll say literacy in science and literacy in healthcare, are very low. And there's a fundamental misunderstanding. I remember people saying, Anthony Fauci was an idiot because he changed his tune from 1 month to the next. No, it was because we learned. When Barb and I and Mark were younger practitioners, many years ago, we said, put your baby on their bellies to go to sleep because otherwise they'll choke. Now the reality is we have data that shows if you put them on their back to sleep, it reduces SIDS deaths by at least 50% because we have data. So as I've come to say now, science is science and politics is politics. Try not to mix those together because they just don't mix all that well. So with that, I think we're pretty close to time here. So I will go ahead and take some questions or comments.
Someone did have a question for you, Scott.
Mm-hmm.
In doing your research, did you find from the 1918 flu, when it waned, how long did it actually take to kind of go away without having a vaccine?
No, I really didn't, get into that in terms of what the pattern was of the decline. But I do remember there was initially a steep decline and then a more gradual decline. But no, I don't. Sounds like a Marianne question.
And
You
Dr.
might have
Cohen,
been right. You're right.
Dr. Cohen and Chrissy, and yes, I agree, it's probably Mary Ann. But I do want to say that I noticed from photos from back then, the Spanish flu, they were masking quite a bit, which
Yeah.
I found incredible, like bandanas or whatever they had, kind of scarf. Interesting.
Mm-hmm. Yeah, I think we knew public health measures back then. We didn't have a lot of resources, but we knew public health measures with hand washing, isolating people, wearing masks to prevent, though the masks they had back then weren't all that effective. They were highly porous cloth masks, and they weren't multi-layer masks, and certainly were not N95s, but they were better than nothing. So yes, absolutely. Other questions?
Well, I don't see any more questions in the box.
Okay, well, I hope everybody enjoys the rest of the asynchronous portion of this. I think this is the only live portion, right?
Yes.
Okay.
There was 5 other presentations to view on your own. And then when you're actually done with that, you can send in your evaluation and we'll know that you participated. Even if you watch 1 section or 2 sections, you can even say that and then just email those to me. So we appreciate you doing a live talk with us today, Scott.
Absolutely. Thank you. I enjoyed chatting with this group. As an aside for this group, we'll do this again next year, I'm sure. If you all could get your requests to Chrissy or others regarding what you'd like to hear about or what you think you'd like to hear about going forward, it may not be obviously timely, but in terms of the topic, it would be good to hear what you're interested in.
Yep, for sure. We like to make it interesting, and it's a lot more fun when we're all together and having lunch and doing funny games. So we'll, we'll hopefully resume with that next year.
I just want to say quick, Dr. Cohen, thank you so much. I enjoyed this. I do love history, and this was awesome. It's great learning for all of us. We always have to learn from past and for moving forward and improving whatever we can do. Also, I wanted to say thank you to Isaiah so much. His efforts too throughout all of this pandemic, huge. This has been fun, and like Chrissy, I agree. Hopefully next year we can all get together. And Chrissy, thanks for everything too.
That'd be great. Yeah, thank you all for putting this together.
Thank you.
Bye, everybody.
All right, with that, we'll end it. Thank you very much.